Hello, spinal hygiene doctors. Welcome to another live group coaching call. Thank you for being on here. I really appreciate it. Today is a really cool topic, I think, and that is the new patient experience. That's what we're going to be talking about here in just a second. And just to remind you, if you're watching from the live class page, then below there is a chat roll, is what we call it. And feel free to comment in that chat roll. I'm going to be watching it as we go. And let me know if you can hear me okay. Let's see. I'm going to test it out here, make sure that I'm on live. There we go. Good. All right. Yeah. So feel free to place any comments below in that chat, or if you're on Facebook, I'll try to monitor that as well and refresh the feed there. You should be able to see my live feed on Facebook in our Facebook group, our private Facebook group as well. Yeah, good. If you're not in our Facebook group yet, I send it out with every email. The private members get the emails, and you can click on the link at the very bottom of the email, and that will allow you to join the group. So awesome. Now, first of all, I have a big announcement to make. Every single one of you are going to get this. It's really cool. It's right here. The new DVD just finished, just came out. This is what it looks like. Let me compare it to the old one for you. I know you guys all probably got the old one already. All right. So check this out. This is what the old one looks like, right? Had the old school exercise sheet in it and everything. This one is better. It's just as good or better because what it does not only looks better on the outside. I mean, you can see that. Check out that disc, and then check out, that's the new exercise forms that we use in our kits. How cool is that? But this one, if you're playing it in your office, it's about 43 minutes and it loops, so it keeps going around on loop. That's good. But if your patients get tired of watching this one is really cool because it's over 2 hours worth of content. It's got the same, the animated movie that we made to educate about spinal hygiene, and then it has the whole first series of the spinal hygiene podcast videos. So it's videos, but it's me teaching spinal degeneration, telling people how damaging spinal degeneration is out there and why they should take care of their spine and how they should take care of our spine. So it's basically educating our patients about lifetime wellness care. Well over 2 hours of content on these, and you can play it at loops also in your office, so you never have to touch it. You just hit play, and your patients can get all the patient education they need for lifetime spinal care every time they come in your office. And guess what? Every single one of you, I'm mailing these out to you today, no charge, completely free. Hopefully I'll get them all out today anyway. I'll get them all out this week, and you should be seeing this in the mail in your office really soon if you're a spinal hygiene doctor member. So I appreciate you, and I hope you really enjoy this. I hope your patients really enjoy this, but it's even more training on lifetime spinal wellness, creating, helping people take care of their spine, but also creating better retention in your office. And not only retention, but what's the word I look for? Compliance. The more somebody knows about how to take care of their spine, the more compliant that patient will be to your recommendations, because they know you're trying to help them. It makes sense to them. They understand their care. And that's why this is called at-home spinal care, patient education for the promotion of lifetime spinal wellness, because that's what we're promoting in our office. Lifetime spinal wellness. This is what it really was meant to be. So this will be coming to you free of charge, and you should see it in your mailbox before too long. Let me know if you don't get it. But so anyway, I thought that was cool. And then we'll jump right into, good. I'm just refreshing. Every once in a while, if I pause on this video, it's just because I'm looking to see if there's any comments or questions. Okay, good. And sometimes I have to refresh the screen to see, excuse me. And all right, awesome. Okay, so let's talk about the new patient process. I'm going to actually walk you through the life cycle of a patient in our office. Now, 30,000 foot view, is we want this person to have a great experience. And the way they do that is they want to see good energy in the office. They want to see smiles. They want to see happy. They want to see friendly. Like in my office, if you've ever seen the office tours, it's not like clinical, sterile clinical environment. Like if you go to a medical doctor's office and you have to sit on the paper, and you have like a sink in every room. If that's what you have, that's fine. If that's what you want, but I try to make the office real home, like based, real homey, so people kind of feel they're welcome. We have big, comfy couches in the waiting room, type of a thing. So I want the environment to be homey. I want it to feel family oriented. So we have testimonials and pictures where kids have drawn pictures for me, and we framed them and put them up on the wall. Um, we have a family room now, which used to be my office. So I had an office with a desk and a computer and everything, like a real office. And I was like, man, it's not getting the use that it needs. And I'd rather see kids and families and those have a place where they could, change diapers, breastfeed. Kids could get adjusted. We put a Tiger adjusting table in there and toys in there. So when the kids were playing in there with toys, they didn't want to come back and get adjusted. They just want to play with the toys. So I put a kids table in there. And if they're in that room, I'll just go adjust them real quick in that room. And it depends on what you want. Like if you do want more of a PI office or I don't know that all of you on the line want that, but if you do, then make it how you want it, that we want the environment to speak for itself. Let's see, the 10,000, 30,000 foot view. What would I that's the main thing. I really want happy. I really want loving. And then you'd have to decide, what energy do you want? What feelings do you want patients to feel when they come in your office? I want them to feel healing. We put up a big frosted glass sign that says, "I am ... healing." So like start to get healing on people's minds. I want that to be the focus, not really how am I feeling, but how am I healing? All of that philosophical type of stuff I like. So anyway, once you determine what feel you want in your office, I think that's important. I think you need to know what type of feel and try to create that. Now, the second thing is the procedures step by step. So let me walk you through those, okay? So first thing might be new patient phone call. Again, in my office, we want smiling, we want happy. We don't have per se scripts, but we kind of have an outline of what to do. When we answer the phone, we always say, "It's a great day at Pure Life. This is Dr. Tabor. How can I help you?" Or, "It's a great day at Pure Life. This is Gina. How can I help you?" Right? And then we would go through, the main things like gathering their name or their number, asking them, how they heard about us, asking if we can email them the paperwork for their new patient appointment. We can get it scheduled. And then when they come in the door, we need to know their name. I know that, every chiropractic coach and manager and everything says this, and my office probably doesn't do as good a job as we should. Knowing their name, yelling their name, say, "Hey, John, you must be John, right?" And like coming around, shaking their hand, loving on them. I think that's important. I think that's really cool. And then asking them if they have their paperwork. If they don't, we'll get their paperwork. Now, here's what goes on in my office after they fill out the paperwork, they hand it in. Then one of my office manager or my rehab tech is going to say, "John, I'd like to give you a tour of the office, and if you'll follow me." And we do the tour, like we know exactly where we're supposed to go and what we're supposed to say. Your tour is going to kind of have to be your own because you want to show off certain things. Like, for instance, we walk by the bathroom first, we show that. And then we'd show, this is our family room. This is where kids get adjusted sometimes. This is where moms can take care of their babies. We have a birth center that's right next door to our office, and they send women through pregnancy and with newborns in here all the time. We love taking care of families, and we show them, so that they could see the family room first. Then they come back and they say, this is the hot seat area. This is where, if you do become a member in our office, you don't have to wait at the front anymore. You can come right on in here, start warming up your spine, and get ready for Dr. Tabor to adjust you. Then we come back to the back. We say, these are our treatment areas. This is where you get adjusted. It turns the power on. And then I have a wall of, I call it my wall of fame. It's like all the people who were kind of semi-famous or whatever. I had them sign, autograph something every time I adjusted them. So there's like a couple of football players, I was a team chiropractor for the West Texas A&M Buffaloes, so we have a big team picture of them. Um, couple of bands that I got to be I got to be a chiropractor at the Winter Jam, so like Christian bands that came through, and I got to adjust them. I always got them to autograph stuff for me. So I always say, so in the tour, it's like, this is the Wall of Fame. Dr. Tabor got to treat some really cool people in our office, and these are their pictures here. He was the team chiropractor for the West Texas A&M Buffaloes for a couple years. And then they say, okay, we'll go right this way. They go back into the other side, which is our rehab area. And we say, this is our rehab area. We do structural corrective care of the spine here. And then right back here, we go through the exam room. Now, I always had kind of okay, so they get taken to the exam room. The front desk says, okay, great. I'm going to let you have a seat here. Now, used to, they would say, Dr. Tabor will be in just a minute. And I would come in, and then I would go through my spiel, like the whole spine should be straight from the front. They shouldn't have any tilt shifts, translations, or curvatures from the side. The spine should have natural curvatures. It should be approximately 40 degrees, 40, 40, and 40. To be exact, the best way to measure that is through an X-ray. So we're going to take X-rays anatomically. We're standing just like this from the front and from the side, so we can, notice disc spaces. Is there any pressure on it, right? So it's like basically the spiel that you give. I would explain chiropractic and explain what we do in our office every single time for every single new patient. So what I did was, to save time, is I created a video of me doing that spiel, right? That what is chiropractic? I'm holding the spine. I tell them what alignment the spine should be in. It takes about 6 minutes. That's all. And it's already hooked up to a laptop that's hooked into our TV in the exam room. So now what happens is the front desk would actually take them into the exam room, have them sit and say, I'm gonna have you watch just this video just for a couple minutes, and then Dr. Tabor will be in right after the video. Okay, so then they leave that exam room and they go in and they hit the button on the little kitchen timer in the front desk that's marked for 6 minutes, like exactly how long the video is. And that way, when the video is over, they can send me kind of a Skype message, or they can let me know that, or they can even let me know that the video has started, but then they can let me know that the video is over as well. I've found that to be very helpful. I found it to be like mentally, like, saving grace for me. Like, I started to really not like new patients, because I was like, oh man, I got to do another new patient. I got to do another new patient. I got to go say this again, and da 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 da. And just having a video that does half of my new patient process for me almost is really nice. And so we play that video every time. I'd recommend that you do that. We have an associate now that helps me with the process. So if he's doing the new patient history, he just goes in after the video, and he would kind of introduce himself and do that as well. But the video is cool, and they get to see you, and then you come in, and I have a feeling like they kind of feel like you're almost a celebrity if you're on TV. You know what I mean? Like, this guy was just on TV, and even, I know it's not really, they probably don't really think I'm a celebrity, but I'm sure it comes across as some form of authority, right? Okay. Now for me, my associate, when he was coming in, he wants to do more of the like spirometer, range of motion, all these things. And that's fine, because every doctor is a little bit different. You have to do what you are comfortable with and you feel confident in your exam. That's why, even if you look at all of these coaches, like you look at Dr. Fred DiDomenico, you look at Dr. Stephen Franson, you look at, even CJ Mertz used to, or Ben Lerner, or just these great chiropractic coaches. None of them, I've been in their programs, I've been to their boot camps, I've been to their seminars. None of them will tell you how to do your examination. The reason why is because you have to do what makes you confident, right? I started out doing everything, range of motion, orthopedic tests. I did surface EMG. I did anything you could possibly think of, because that made me more confident in what I and what I use. And now, we're limited. What I would really use more is the surface EMG and the X-rays, basically, and maybe palpation, right? But you got to do what makes you feel confident. If taking more things, if taking a lung expansion test, and doing a pre and post makes you confident, do that, man. I got a friend who's a chiropractic neurologist. He always checks that, and he knows, because he knows that the adjustment in the thoracic area actually increases lung expansion, and increasing lung expansion correlates with increased oxygen levels in your blood, and increased oxygen levels in your blood, it correlates with improved healing. Improved healing means the patient's getting better. So when he can measure that you only had, a half an inch lung expansion when he started, he adjusted you. Now you have a 2-inch lung expansion. He knows for a fact in his mind that you're getting better because you're healing better. And that to him makes him confident. So see what I mean? I think it's important that you do exactly what it is in your exams that make you confident and that help the patient as much as possible. Those are just my feelings, but I think that's important. All right, so I'm getting X-rays now. I think I have a really cool way of explaining X-rays in my office, because we do standing weight-bearing X-rays, and a lot of people, even you might have had this. They come in and they say, I've already had X-rays. Maybe I can get them from the emergency room. And that person, that first of all, they're probably just going to get an X-ray report. Secondly, that report's a bunch of junk. Just stamp normal on everything. You might as well just stamp normal on everything if they don't have cancer or a fracture, right? And they weren't set up properly in that X-ray either. They're probably laying down on a table. So I'll tell them, I'll go through their exam. We found this, and this, and my recommendations are for you to allow me to do very accurate measurements and get my own X-rays on this, because we need anatomical X-rays. It's very important for us to get accurate measurements, and you have to be standing in what we call anatomical position, feet shoulder width apart, looking straight ahead, and then we want to get that arms to your side, those types of things. And so weight bearing in anatomical position allows me to take accurate measurements, and then once we correct what we need to correct, allows me to take accurate measurements again to make sure that we've corrected your problems. And so when we explain that to the patient, they're like, oh, well, you need to get your own X-rays, right? Anyway, I think that's important, and I think that's really cool that you can take accurate measurements, because medical X-rays, I used to send out for X-rays and get reports back. Even after we got an X-ray machine, I used to send out my X-rays to a radiologist to read them. And every time, I'm literally hundreds and hundreds of patients coming in, people who crawled in my door, couldn't move, had all their X-rays come back stamped normal. So if they don't have cancer or a fracture, you're very rarely going to see what's going on an X-ray. They might tell you that they have arthritis on an X-ray, but other than that, that's it. So anyway, that's my 2 cents on that. All right, so after I'm done with the X-rays, I'm gonna tell the patient that, all right, so I'm gonna invite you back to the second day. That's our doctor's report. This is a very important visit, because I'm gonna show you exactly what we found on those X-rays. I'm gonna actually show you how we measured that, exactly where the subluxations are, how they're irritating those nerves and causing the symptoms that you came in with. I'm going to encourage you to bring your spouse back for that visit, because we're going to go over finances on that, and any recommendations that I might have for you. And if I can actually help you, I'll do my best to show you before and after X-rays and other case studies that we've done in our office, and show you exactly how we correct them so you can know what to expect. How's that sound? Good. All right, let's come up here to the front desk. My front desk is going to get you scheduled, and take them up to the front and they get them scheduled, and then I go on about my day. So I don't do the adjustment on the first visit unless they, so for instance, if someone's just adamant about getting adjusted on the first visit, I would rather just kind of talk to them. If I can talk them out of it, like if I can explain that I don't want to adjust your spine without seeing it, because if they are in bad shape, like I'm not adjusting that spine without seeing it. If they're not so much, maybe they've been under care, they're traveling through, or let's say it's like a Thursday, they're in a lot of pain. I can't get them back to the doctor's report until the next Tuesday, because I don't do doctor's reports on Saturdays. Then I might treat them and adjust them. And I think that's a clinical decision that needs to be made. And I don't really like to adjust on the first visit, because I like to really take everything into account, analyze everything. But if the cards are lined up right and I need to adjust them on that visit, I do it because I'm the doctor and I do what I feel is right in my office. And that's what I would recommend that you do. And so everybody, you know, there's these guys, are for adjusting on the first visit, guys that are against, and girls that are against adjusting on the first visit. And in both ways, like, they will stand up on that soapbox and tell you, we don't ever adjust on the first visit because blah, blah, blah. And which is great because that's the way they feel strongly. But I won't tell you that I never adjust on the first visit. I'll tell you probably 90% of the time I do not. And there might be 10% of the time where I find that I clinically need to adjust on the first visit. I just don't explain anything. I don't, you know, go over their X-rays or anything with them. I tell them we'll do all of that on the next visit, but I usually just adjust the one area that I need to. I don't adjust full spine. I don't adjust everything. I just adjust one area that I found that needs to be adjusted and would be most efficient to help them get through a weekend or something. So I'm just being open and honest and telling you what I do. All right, so that's the day one first visit. The day two, the second day, so I do my doctor's reports on Tuesdays or Thursdays. Okay, I do my doctor's reports at 6:30 p.m. And actually, we shortened our hours now, so we actually do our doctor's report at 6 p.m. So I was open, believe it or not, from 2:30 to 6:30 in the afternoons. And it was just wearing me out, man, because I'd have to be in there adjusting for 4 hours from 2:30 to 6:30, then do doctor's reports from 6:30 to 7:30. 5 hours in the office is way too long. So we moved our hours and crunched them. And so in the afternoons now, we're only open from 3 to 6. And then on Tuesdays and Thursdays, I do my doctor's reports at 6 o'clock, right? So Tuesdays and Thursdays at 6 p.m. Now, we do have an option for Thursday at 1 p.m. that sometimes if people absolutely can't make 6:30 p.m., we'll do a Thursday at 1 p.m. as well. And then in my Tomball office, we do reports Tuesdays and Thursdays at 11 a.m. No other options. Tuesdays and Thursdays at 11 a.m. So see, you could do reports whenever you want to. My office proves you can do reports whenever you want to, because we have people who come to any one of those reports. And sometimes we'll just do like sometimes we'll be like, we're only doing 6 o'clock reports this week. So we'll just do that. Or like in Tomball, we only do 11 a.m. reports. That's it. You can't get in any other time. And it works fine. So whenever you think you need to do a doctor's report, if you do a doctor's report, so a doctor's, let me explain that. If you look in the members area under in-office workshops, you'll see my doctor's report. The first one is my doctor's report. And by the way, I just had somebody who purchased the program and then like the day after quit the program because they didn't realize what was in there. They thought that the spinal hygiene presentation was all that in-office workshop was with all the X-rays. That's my actual doctor's report, okay? I put that in there for you. The spinal hygiene presentation is down at the bottom, which I might switch that, put it up at the top for you. But the in-office workshop spinal hygiene presentation is the one where it doesn't really have any X-rays in it. We talk about spinal hygiene. So, okay. So then the second visit, the doctor's report, is where I actually show them before and after X-rays. I explain what we do in our office. If you don't do X-rays, just show before and after, scans, or before and after palpation charts, or before and after whatever you do before and after. And then once I do the doctor's report, mine's about 30, 45 minutes. We break out individually. So my doctor's report is with groups, usually no more than about 5 in a group, 6 at the most, maybe. I mean, I have had more than that, but it gets a little bit crazy. So we usually do about 5 or 6. Sometimes it's been up to about 10. It just takes time. It takes a little bit longer. Now that we have an associate, I could do 10 and it's no problem. But typically I would keep it around 4 to 6 if I were you. Now, so we break out and so I do the doctor's report and then I take them one by one in order of how they showed up. Okay. So if they were here first, we're going to go over their X-rays first. That's just how we do it. Now, once I'm going over their X-rays, what I do is we take them back, put their X-rays up in a view box, and I turn starting with the neck from the side, I turn it on and I say, here's your cervical spine. Tell me what you see. And they would be like, well, there's no curve there, or whatever. The curve's going the wrong way, blah, blah, blah. Be like, yes. And then we just kind of go over their symptoms and then I show them. So I would put the upper from the front, upper from the side, and then we would go over the lower from the front, lower from the side. Those are the X-rays that I normally do in my office. And then I ask them, I say, is this something that you are committed to correcting? Is this something that you would like to move forward with? Is correction in my office something that you would like to move forward with? And then usually they say something like, well, yes, absolutely. Or they'll say, well, it depends on the price. And I say, okay, great. Well, I don't do any of the finances myself. I will have my office manager come in and show you the finances. I used to do all the finances. So if you do all the finances, do them. In fact, only up to about a couple months ago, I did all the finances myself. But we just switched it because with more people in the group, I needed to get to the next person faster. So um, now so I don't do the finances. Actually, my office manager, Jenna, will actually come in and go over those with you. But first, I just wanted to determine whether this is something that you want to correct or not. That if you'll commit the time and the energy to actually, because I went over that your frequency is going to be 3 times a week for 4 weeks, 2 times a week for 6 weeks. We'll do a re-exam and a re-X-ray. Is that something that you would commit to if the finances were all right? And then they're either yes or I don't know. If they I don't know, I was like, well, why don't you go home and think about it and then let us know? Because I don't want to waste my office manager's time if they're not going to do it. And so if they say yes, yes, if the finance is right and if any way we can do it, then yes, I'm committed. And then we'll have Jenna come in and go over it. Simple as that. Now, if they do commit, they do start care, then I will adjust them on that night. But I tell them I'm only doing the adjustment. The adjustment is the most powerful portion of this. You do have your rehab that we're going to explain to you on your next visit and show you how we do that. But I really want you to feel the power of the adjustment and just let me know how you're doing on the next visit. Okay, so we just get them adjusted, then they leave. So that's day 2. Day 1 was the exam. Day 2 is the doctor's report and financials. Day 3 is an important day. All right. Day 3, let me check and see if I have any questions or comments here. All right. We're doing good, guys. We're doing good. Cool. Oh, I got some messages. All right. All right. Good. All right. So day 3 is important. And I got, let me show you this. So when we go over finances, this is not the exact piece of paper. I just sent a new order to Kinko's. We have it out on nice shiny paper, but I printed this off real quick. When we go over the finances, this is the sheet that we go over. In the archive section, I'll have all of these forms underneath the video, but this shows the exam, their corrective care, and their wellness care. Because their wellness care, they don't have to start the wellness care right now, but at least they know that this is the plan in my office. The long-term ongoing plan to take care of your spine is this is what we did with the exam. This is what we're going to do with the correction for the first 3 months. This is what we're going to do for the rest of your life, right? So we show them this. If they say yes, we'll commit to the corrective care. That's the first part. This is the contract we use. I'll give this guy to you as well. I'll put it in the archive section, but it's basically just the contract that for our lifetime wellness plan. It's $140 a month, and then it just basically says, I understand payment is done on a monthly payment, blah, blah, blah. I'm not a lawyer, so I don't know whether you guys can do that or not, but those are the forms that we present for the financials, okay? Now, on day 3, when they come back for their first full visit, they're going to come in. They have their key tag. They get their little key tag on the night when they start care. They would scan their key tag. They come back to the hot seat area. My staff knows that this is their day 3, so they will. Somebody's peeling off my hours sheet. The heck? Huh. We have our hours on our front door, and I need to go stop her, I guess. But she's just pulling off our. Oh, you know what? She's probably gonna clean the windows. All right. Anyway, okay, so they come in for their day 3. They scan. They come back. My office staff comes back with them, shows them how to wobble because we have wobble discs in our hot seat. Then they would get adjusted, and then I take them into the rehab room. It's the only time I would actually leave the adjusting tables and take them into the rehab room and tell I tell the rehab tech what their reverse posture exercises are, and they would do like curve traction, vibration platform, reverse posture exercise. And then day 3 is when they're going to sit down and do this sheet. So one of my staff is going to sit down with them and go over the day 3 sheet and go over their home care. So on day 3, they're going to get their home spinal care bag. Now, first they're going to go over this sheet with them when they go up. So they're done with their visit. They go up to the front desk. The staff gets this sheet. It says, as a patient receiving care in our office, we ask that you help us tell others about optimal health. Who doesn't deserve to know how to live the healthiest life possible for themselves and their family? We want to invite you and all your friends, families, and coworkers to a wonderful dinner on us. Dr. Tabor will share his story. You'll learn some amazing things about your health, and your guests will have a wonderful experience. Are there any names and numbers or people that you'd like to invite? We definitely want you to contact them, but we want to send them an invite as well. And so they would just write their names down here or whatever, and we'd get them scheduled for the next doctor dinner with the doc. Now, you'll also notice below that it says, may we cater lunch and do a catered lunch and learn for your organizations, your church, or your business. And if they have church, or if they have a business, or if they want to do it at their house, or 5 or more people, we can schedule that with them there too, and schedule our lunch and learns with our day 3 here. All right, so this is day 3 sheet. Once they've done that, gone over the day 3 sheet, then they're going to go through this home care kit. It's like, you're going to get your home care kit here, and then you can pull out the instruction sheet, and these are the exercises. The first and the last are the exercises you're going to do in the morning when you wake up, and at night when you go to sleep. And then these 2 are the ones you're going to do during the day. Okay, so these are really easy. They have all the explanations here, all the instructions, so your staff doesn't really have to instruct these. They might kind of go through and say, it's fairly simple. If you have any questions on these, just let us know. Basically, range of motion, forward, back, left, right, rotation, using the band here to do the head forward posture exercise, sitting on your wobble discs every day. And then we actually air this up for them. So this is the wobble disc that it comes with. We would go back to the hot seat area and grab them an aired up one, unless that person just wants to do it themselves. And then but they already learned how to wobble because they do that in our hot seat area anyway. And then our staff would grab these, and they'd say, with these spinal molding rolls, you're going to place one underneath the curve of your neck, one underneath the curve in your low back while you're laying in your bed. And before you go to sleep, you just want to lay on these. Start off with 5 minutes and then work up to 20 minutes as it is comfortable for you. All right. And again, if you have any questions, you can go to homespinalcare.com. You can see all the exercises that are on that website, or you can just come right back in the office and let us know if you have any questions, and we'll go over them when you get here for your visits. Okay. But they're very simple. They're designed to be extremely simple, and they're designed to make sure that you don't get a lot of questions on how they're done. Anybody can do these exercises, and it's healthy for them. All right. So that was day 3. And then that's it. They're gone. So that's day 1, day 2, and day 3, and they are a patient in our office, and that's when shotgun education starts. So when day 3, we want to make sure that this is playing in the waiting room or in the hot seat area, because they're going to get this lifetime spinal care education over and over and over. For my table talk now, I put whiteboards above or around each table, and what we do is we take each topic, like each spinal hygiene. I use the spinal hygiene podcast episodes, and each topic every day I'll put a topic on the whiteboard, and that way, if that brings up a discussion, we can talk about, like, for instance, right now, I think the one that's up there is the question is, what causes spinal degeneration, right? And then the answer is, like, basically spinal misalignment, decreased range of motion, and imbalanced muscles around the spine. And then I say, AKA subluxation, and then we can talk about why they're here in our office, getting those things corrected and learning how to maintain that on a daily basis. So that could be table talk. So they're getting that on a regular basis. Next week, we're going to talk about emails. We're going to talk about setting up an email follow-up sequence, and I'm going to show you guys and try to give you guys an email follow-up sequence that will also drip education to them, and it's part of the shotgun education that you want to do in your office, because we want them to have a great experience through their new patient, day 1, day 2, day 3. Then we want that education to just be constantly shotgunned at them every direction. We want lifetime spinal care, lifetime spinal care, lifetime spinal care, lifetime spinal care, all through their corrective care plan. So if they're here for 24 or 36 visits, they're here for about 3 or 4 months. For 3 or 4 months, they need to get just hammered with lifetime spinal care education. So then we have the best chance for them saying yes to the re-exam and the re-sign in the wellness care. And they've already seen what the wellness care is going to be, because we showed them this plan in the beginning, so they know that it's coming. And if they learned a lot about lifetime spinal care and had a great experience, and they, you know, they enjoyed being there, then a big percentage of them will start your wellness care. Not 100%, not 100% of anybody is going to start anything, but the more education we can get about lifetime spinal care, the more bigger our percentage is conversion to wellness care, and the bigger percentage, the bigger chance that they're going to come back to you as well. So they had a great experience. They learned a lot. That maybe they're doing their exercises at home for a little while, but you are the expert because you showed them what to do, and they're keeping that on the forefront of their mind. They're being more aware about it. They're coming back to you like you're their chiropractor, you know. And I think that's important. I think that's awesome. All right, guys. So that is the new patient experience, day 1, day 2, day 3 in my office, and realize that yours, it should be yours. So you might not do group reports. You might do just single 5-minute report of findings, 10-minute, 30-minute report of findings with one person. Whatever you do, make it your own. Hopefully, though, you learn some tips and kind of the outlines and strategies for a way to just make the new patient experience better and improve it in your office. And I'm always trying to think of, you know, creative and innovative ways to improve that experience, right? That's really what it's all about. And it can change, it can evolve as we go. I'm going to be the doctor and the clinician, and I learned that through using coach after coach after coach. And I found out that, look, I don't like doing it just the way somebody tells me to do it. You know, I like trying it, I like changing it. That's why we did a 36 visit when I started, because my mentor did a year-long plan. That's what I started doing, year-long plans. And I decided I just don't want to do that. You know, I don't want to do it. And that's me. It's my office. I'll do whatever I want to do. I'm going to test out something different. So I tested out different things. We did a 36 visit plan, and then people were dropping off before the 36 visit plan. So I wanted to get them in wellness care by the time they dropped off. So we tested out some 24 visit corrective care plans, and are making sure we get good results with that, making sure that our conversions are still high for our wellness care. And so I encourage you to do that. Test it, tweak it, make it your own. Continue to try to innovate and be creative with helping your patients get better results, number 1, and helping them to have a better experience, number 2. All right, guys. Thanks so much for being on the call today and the training. Next week, we're talking about email marketing, and we're talking about setting up automated email sequences, okay? So I'll see you next week. Have a great one.